Okay, so as you all know, so we'll start with the format and everything. So, like, you should have a clear plan by now because you already started preparing for exam. So that we will start with the basics, the format. So you know that how many questions we will be having in the CPC exam?
100.
100. Okay, and the passing score will be 70%. So here most of you have some kind of misconception that do we have to score in all section above 70 or overall 70?
Overall 70.
So overall 70%. Okay, so whenever you choose to go with AAPC self-paced course, for that course only they will ask you need to get above 70% in all the section. Okay, so for example, in case studies also you need to score above 70, and in surgery portion also you have to score above 70. So for course completion module they will keep that format, but when it comes to CPC exam you need to score more, like throughout all section. If you get 70 marks, that is enough to make you pass. Okay, don't think like you have to study everything to get score above 70. Okay, somewhere you may feel like some section is not working for you, then you can skip that portion and you can work better on the other subject where you are really good at. Okay, so now as you know, the time duration or the limit is for 4 hours, and the question types are multiple choice, and it's an open book exam. You will have the here in India, I hope everyone the today's session who have joined are writing in exam in India only. So here in testing center they will provide you CPT book, ICD book, and HCPCS book. All three book they are going to provide. But
Ma'am, I am from Sharjah. I am writing the exam in Sharjah.
okay, then you have to get your books. They'll not
Yes.
provide the books, so you have to get your own books. So that too, if you are writing in UAE, you will not be, you can't mark too much on your book. It should be like they will ask you to
Yes.
bring up clear copies. Okay, so better you can rent some book and you can go and write exam.
Yes.
Yeah, so here in India they'll provide clean version of book. So also we do have option for ebook. Okay, whenever you book your exam slot, you will have option to redeem whether you want printed book version or ebook. Okay, you will have that option up to before your exam date. Okay, like suppose your exam is on 3/21, you will have opportunity up to 318. Okay, up to 318 DOS. You can either choose to go with print book or ebook. Okay, so if you go with ebook, you will have access to the library. I mean, when you go to the testing center, you will not give, they will not provide you books because it will be printed on your hall ticket itself, so that by seeing your hall ticket they will see and they will give you the access for ebooks. Okay, in your computer itself you can have the other section for book where you can access CPT book, ICD, and HCPCS book. Okay, like completely PDF version. It's not PDF, it will work digitally. You can use the search also in the ebook. So if you are having good experience on ebook, you can prefer to go with ebooks. But in your institution, or if you have practice through print book, then it is good to go with print book version only. Okay, so this is the format that we will have for CPC exam. So then coming to the syllabus, as you all know, we will have medical terminology. So your exam starts like this. Okay, as soon as you open, like if you just book the exam slot from AAPC, you will receive one notification or one email where there will be having a demo link. Okay, most of the students will miss it. From AAPC itself you will have the demo link. If you click on the demo, there they will show how your exam format will look like. Okay, what is going to start from, and how to flag the question, how to unflag the question, how to utilize the calculator, how to use the notebook. Okay, everything, there will be a demo video which will be sent on email. There will be link, okay, now from AAPC. So you just have to navigate and you have to first see the demo so that it simulate the exam environment. Okay, you will get to know how exactly the exam format will look like when you sit in the testing centers. Okay, so then you are as soon as you open your computer, as soon as you log into the exam, as soon as the time starts, you will start with the medical terminology and anatomy section. Okay, so you know the marks distribution. So you will have 4 marks for medical terminology, you have 4 marks for anatomy, compliance regulatory coding guidelines. So section by section you can able to see. So say for example, if you start medical terminology, okay, you started with this medical terminology section. So then there are 4 questions, right? You must complete all those 4 questions. Whether you are not sure, if you are not sure for any one question, you can choose any one answer, but you can flag that. Okay, like for later review, you can maybe 3rd question you are not sure, but you have to choose the answer. On random answer you have to choose. So you have to maybe option B you are selecting and you are flagging that question. Okay, so that later you can unflag and you can select later part. Okay, so then you will again have the sections. So in this section you don't want anatomy to go next, so you can skip directly to ICD-10 section. Okay, so section by section, but once you start one section, mandatory you must finish that section in order to move further. Okay, so while encountering or while starting any section, you will have opportunity to jump for other section, but as soon as you start compliance and regulatory, the mandatory thing, you need to complete all the 3 questions. Either you can flag the answer, or if you are sure, you don't need to flag that. So after using all the 3 questions, your section will be over. Compliance and regulatory is completed. Okay, so likewise you will have the opportunity. So you don't have to think like I cannot, I have to go in the same order how the exam format is coming, I have to go in the same format. You don't have to think like that, because once you see the demo, you will understand how to go by different section before attempting the prior ones. Okay, so as you can see here, up to here, see, medical terminology, anatomy, compliance and regulatory, coding guidelines, ICD-10 CM direct questions, and HCPCS level 2. So from here, you will be able to score 26 marks. Okay, 26 marks. And this 26 marks, so nowadays, as you all know, this become very much easy. So you got to know that, like in YouTube itself, if you check all the repeated question for anatomy, medical terminology, compliance and regulatory, coding guidelines, everything is available. Okay, and it's not like every month paper going to change. Okay, so if you have that kind of information, that's a like misleading. It's not like you have your paper is going to change every month. So AAPC will have the standard cert will get updated on every January. Okay, they will just dump some 7 papers, okay, like set A paper, set B paper, C paper, D paper. Likewise, there will be some 7 set of sets will be there in the exam board. So morning your friend writing, okay, they have the morning slot, and your friend might be getting paper A, and you have the afternoon slot, you might be getting paper B. Okay, like that it works. So far many of the students have wrote exam and they know all set anatomy questions, all set terminology question, it is readily available everywhere now. Okay, so it is not difficult anymore. Earlier when it was 150 questions was there for CPC exam, that time it was so difficult, and that time certification also had so much value. Okay, it was very difficult to pass the exam. But now since everything become like this, everything is getting circulated like this, there are many people getting passed. Okay, so now the credibility is not about getting the certification. So your knowledge, or the whatever that you have learned in the CPC preparation or the exam preparing period, you have to prove yourself in the interview or in the company assessment. Okay, so if you can pass the company assessment itself, they are going to onboard you for the floor. Okay, so that like that it has become now, because there are too many certified coders. Like earlier, and if you compare to India, UAE is good. Okay, UAE has no thing like your questions are getting leaked. No, UAE is good. USA is good. USA also, nobody will do the malpractice and nobody will follow the shortcuts. They'll learn and they'll get past. But here in India, what happened? It is like that to this year. It's like way worst. I mean, every chapter, okay, chapter itself. I mean, you belongs to Karnataka means you will have the Bangalore chapter. Okay, AAPC chapter, local chapter will be there. And if you are from Kerala, you belongs to Kerala chapter. And if you are from Tamil Nadu, then there will be Chennai chapter. Okay, likewise, for each states, you will have the AAPC local chapters. That means you belongs to one certain chapter. So in this way, they will see how many AAPC members are added to this chapter, and how many members have passed. Okay, how many members have failed. Everything there will be raw data. Okay, so now in 2025, what is happening? Every chapter, earlier like some 40 to 50 past candidates were there. Now it is like 300 past candidates, where maybe 3 to 4 or maybe 10 students got failed. Okay, so it's not good. So you have to think, if you opportunities are there for job, opportunities are there, but where the credibility? Earlier they were asking only certification, but now certification is not enough. Okay, you need to have a good knowledge, and wherever you go, you should prove yourself that you have really learned CPT, you have really learned ICD. Okay, so the certification is not defining you anymore. Okay, so but now, since you have already joined the courses and you are going to write the exam, the passing criteria is important. Okay, so I don't recommend, or I don't say everyone will follow the same thing. So if you are genuinely practicing, this guidance will help you. Okay, that's why I'm discussing all these things. So now, if you can see 26 here, so this 26 marks, assume out of 26, at least you can get 22 marks. Okay, that is already in your pockets. It is already there in your pocket. And how much time it will take? So this CPC exam is for 4 hours, 100 question. That means you will be having 2.4 minutes per question. Okay, you need to use 2.4 minutes per question. But this is not needed for the initial sections. Okay, so you have 26 marks, and medical terminology and anatomy 4 question. You don't need 1 minute to refer, since you know already some idea on the important things. So you can just finish all this 26 marks maybe within 15 to 18 minutes. First 15 to 18 minutes, you can attempt all these things. Okay, so you will be able to attend. Okay, you will be able to attend 26 marks question within first 15 to 20 minutes itself. Okay, you can take 1 minute for each of this section. Okay, because it is very straightforward. There will be no scenario to read. Okay, it will be very straightforward. So you need to minimalize your time. You should not spend 2.4 minutes for this section. Instead, you have to make it 1 minute for each section. Okay, at least maximum. Some may take 30 seconds, 1 minute. Okay, so within 20 minutes, the first section should be over. So the next section you will be having that. So the next section you will be having, see here. After this first section where you can score 26 marks, then comes with surgery. Okay, surgery will be giving you 36 marks. The first section 26, the second section 36, which is surgery. So you know that. So each surgery, the integumentary system or musculoskeletal, respiratory and cardio, and also digestive, okay, genitourinary and nervous system, all include, which carries 6 marks each. Each section carry, or each chapter carries 6 marks. So together you will be getting 36 marks. Okay, so it is very important to decide in this section which section is giving you more marks. Okay, if you are confident in integumentary, you can start with integumentary. Okay, and maybe you are not so confident in this respiratory and cardio. Okay, you don't have to check this. You have to complete integumentary, you have to complete musculoskeletal, you have to complete digestive, genitourinary, and nervous system. Later you can come back to this section. Okay, so, and if at all, if you are starting the section, then you will have the flagging method. Flagging is nothing but you are not sure, let me review this later, because it may taking you so much time. It is not, you're not getting the concept right away, like right when you look into the question, you may not able to figure out what is this procedure is all about, and it is taking some time, you will feel that. So that time immediately you can flag the question. You don't have to spend any random minutes on the question which is not so familiar, or the procedure that you are not aware. Okay, you can just flag the question and you can move forward. In that way you will be saving a lot of time. If you sit and if you are idle, or if you are stuck with single question and you are spending more than 3 minutes or 4 minutes for a single question, means you cannot attend all other 100 questions. Okay, without, the clock will be ticking. I mean, you can see the clock on the computer. The timer will be there. Okay, in the left side of your system there will be timer. So at that moment, in the panic mode, you'll already in the panic mode, you may not be able to concentrate. Okay, so that's why, do not, if you just see the question and you are not able to figure out what it is, flag it and move forward. Okay, this is the best thing that you can do. And then here in the surgery portion, you can score good marks in the integumentary portion. 6 out of 6 easily you can get, because all concept what you will be seeing, okay, whether it is maybe the most micrographic surgery or the debridement, laceration repair, everything is coding guideline based. And if you once understand the coding guideline, easily you are sorted with integumentary system. Though the chapter look big, okay, but the concepts are very straightforward. Like everything is based on guideline. Once you understand the guideline, easily you can apply it, okay, for integumentary. And same way for musculoskeletal also. So they'll always ask question from trigger point injections and orthosynthesis or orthodesis procedure. And somewhere in middle you will also see some question related to the unilateral and unilateral procedures, fixation, unilateral fixation, and also we will have the maybe arthroscopic procedure. Okay, so those are all the repeated concept, because these concept regularly we will code in outpatient setting. And that kind of concept you will see on the exam also. Okay, because certification, certified professional coder, is all about preparing you to be a profi coder. Okay, not the inpatient coder. So ideally in the exam also you will see a lot of concept or questions which are regarding more of outpatient or the profi coding. Okay, not in-depth IP side. Okay, and then coming to the, maybe you may feel here in the respiratory and cardiovascular, you may feel little difficult. But if you are good at CABG coding, and if you are good at pacemaker and defibrillator coding, and also if you know little bit of ECMO procedures, okay, and respiratory is very easy. Okay, it is like you will have the direct office procedure related to nose procedure, sinus procedure, and epistasis procedure. Okay, these are all very minimal and easily you can code. Okay, even if you are not understanding, or even if you are not yet learned also, you can attempt those. But when it comes to cardiovascular, the CABG, pacemaker, okay, and also selective and non-selective catheterization. Okay, some 3 to 4 concept if you are good at, you can also score here. Okay, out of 6 at least you can score some 4 marks. Okay, and then digestive, it is again easy. So under digestive you have to focus on a few important concept, like tonsillectomy procedures, and a hernia repair procedure, okay, hemorrhoidectomy and appendectomy procedure, and mainly colonoscopy. Colonoscopy questions, like in guideline you will get a lot, the decision tree what we have, from that you will be able to see some questions for coding guidelines. Okay, and other, apart from colonoscopy, you can focus on all the other scopies, like endoscopy and gastroesophago, that is like that is also in the EGD all those scopy you can just concentrate. The concept will remain same only, like you have to check which scopy it is, whether it is rigid or the flexible. Okay. And how many like what techniques are using, whether they are using hot biopsy technique or smear technique. Okay, all this is small thing. If you concentrate, you can get it. And then genitourinary. So under genitourinary, like that there will be 4 section. One is for urinary system, one is for male genital system, another one is female genital system, and lastly reproductive system. Okay, so from all 4 section you can expect one question, and mainly from male and female genital system you can expect two question each. Okay. And in the urinary system, the procedure all related to kidney only. Mostly they'll question about the kidney procedure. And current year exam also you can see procedure related to kidney only. Nephrectomy code and partial nephrectomy along with, or partial nephrectomy with uterectomy. Okay, all those repeated question only they have asked. And coming to nervous system, so under nervous system you can check strabismus surgery, hemodinervination, and the injections mainly. Okay, epidural steroid injections and vertebral that is also okay. TSI injections, all those you can check. So this out of 36 marks, if you can score up to 30, okay, 30, almost you are getting 26 plus 30, already you are getting 56 marks. Okay, and so many other section left out yet. Okay, and coming to non-surgical procedures or the section, we have radiology coding, pathology and laboratory, medicine, evaluation and management. Okay, so if you are good at evaluation and management, you can score 8 to 9 marks. Okay, 8 to 9 marks you can score from ENM only. That means here chapter wise you will be getting 6 marks. Additionally, if you look into case studies, okay, in case studies at least you will have 2 to 3 questions related to evaluation and management. How to calculate MDM, or what is the final MDM level. Okay, time based coding, critical care or preventive, along with the office outpatient ENM codes. Okay, so there will be 2 to 3 questions you will see in the case study which is regarding ENM. Okay, so from 6, maybe sometime 6 plus 4 also. Just in the consider 8 marks. 8 marks you can score from ENM itself. Okay, then coming to radiology, under radiology you can focus on mammography. Okay, mammography is very important. The unilateral and bilateral mammography screening code they have asked, and diagnostic bilateral mammography also they have asked. And then this one, what is this? Obstetric ultrasound. Okay, whether they are doing ultrasound examination on like complete examination or limited examination. Okay, like you have to check the gestational weeks, and you have to check the fetus, 1 fetus or 2 fetus. That guideline I hope everyone is aware. Okay, so obstetric ultrasound is important. And also under ultrasound only you also check ultrasound on abdomen and retroperitoneum. Okay, these are all very repeated questions that I have asked in the radiology section. And that radiology is a combined. Okay, they'll not have in this section you can't see only radiology options. Okay, there will be combined coding. They might be doing liver biopsy. For liver biopsy they might be taking one fluoroscopic guidance. Okay, so you have to code for liver biopsy also, and you have to code for fluoroscopic guidance code also from radiology. Okay, so you have to go to digestive system also, and you have to go to radiology also, because radiology is used in all the other sections. In surgery also we need radiology. And when it comes to non-surgical, like the medicine, and also sometime like anesthesia is lesser only, but medicine we will be seeing, okay, related to radiology codes. So the service are important, radiology services. Mostly you will expect combined question here. And then pathology and laboratory, it is again very easy. So you have to check the penal coding and penal coding guidelines, and drug assays, And again, you have to check anatomic pathology and also surgical pathology. Okay, under surgical pathology, you have to check the levels based on the specimen that the physician or the provider is working on, like whether it is kidney biopsy or maybe skin. Okay, skin for plastic repair or skin other than skin tags. Likewise, you have to check the specimen and you have to figure out what will be the level for it. Okay, and then coming to medicine. Under medicine, you have to focus on hydration. This time hydration they have asked, and also you have to check ophthalmology. Okay, ophthalmology repeatedly they'll ask, dialysis. Okay, and then mainly vaccines and injections. Under vaccine, you should know, like below 18 year what are the coding guidelines we have, above 18 year what are the coding guidelines we have. Okay, when you are billing for 90460, how you are going to break down the components into units. Okay, all those things you should be aware. And then evaluation and management as usual, like how to find final medical decision making level, MDM level, whether it is moderate or high level. Okay, so you will have all the three charts with you: problem address, data, and risk. And you can take the two any two components which are meeting, or you can just drop the lowest one. Okay, and if you are having the time based, again you have to check the time, and based on the time you will be able to choose the ENM level. Okay, so here under evaluation management, you need to focus on office visit mainly. Okay, office visit is must and should, both new patient and established patient. And also check hospital and observation service, the coding guidelines, and here initial and subsequent visit. Okay, and then same day admit and discharge coding guidelines you should know. So then critical care question they have asked. Okay, they have asked for 45 minutes of critical care, what will be the code. And you can also refer emergency department, and plus preventive medicine. Okay, these are all the important ENM section you must be aware. Then coming to so if you see anesthesia is again easy. So under anesthesia, you have to check like where they are performing anesthesia service, which anatomical region, and along with that check the coding guidelines and the modifiers, mainly physical status modifier, qualifying circumstance, and also the HCPCS modifier. Okay, the QZ usage, QX modifier usage. Okay, and also you have to check the burn treatment for anesthesia, and also vaginal delivery, for neuraxial vaginal delivery, epidural anesthesia they'll be performing. That also is very important. And then see, from here 36 marks, and from the non-surgical section, you will be able to get 28 marks. So 26, 36 plus 28, and lastly you will have the case studies, 10 marks. Okay, case study for 10 marks. So in this case study, you will, as I already said, 2 to 3 questions belongs to ENM. The rest questions you can get to see from integumentary system. So integumentary, they've asked about ATT procedure, adjacent tissue transfer. Okay, one case study regarding ATT, which is there in case study. And same way we have related to musculoskeletal, we have one case study. It's a big case study, and we will be having one CAVG related case study question. And combinedly, you will be able to see from all the surgical section, remaining questions will be allocated in the case study section. Okay, so hardly if you score some 4 to 5 marks also from case study, it is enough to make you pass. Okay, already I told you the 26 marks here, you can score really well the first section. So target to get out from this section, because it is very straightforward. Compliance and regulatory, just check the HIPAA stands for what, NCCI stands for what. Okay, which modifier will be used to bypass the NCCI edit. Okay, we will be using 59 modifier. And MIPS stands for MIPS stands for what. Okay, and OIG stands for what, and like OIG is considered as a volunteer government agency. Okay, sometimes they will ask OIG stands for, sometimes they'll ask who is volunteer agency. So you should know OIG is a volunteer government agency. Okay, and also you have to check the GA modifier and ABN form. ABN stands for what? Okay, about global surgical package, GSP. And then like those are all enough to give you from compliance and regulatory. And just check what are fraud and what are abuse. Fraud is something that knowingly the provider is performing. Abuse is something unknowingly performing. Okay, so you will have the scenario to choose which scenario best describe the fraudulent activity. Okay, you have to sit and read the 4 option, and whichever feels it's fraud, you have to pick that. Okay, so here also you can score good marks. And coming to HCPCS, they'll ask straightforward only. You just check the drug base value. Some 2 questions they'll be questioning on the drug base value itself, and then other things like durable medical equipments. Okay, wheelchair code, standard wheelchair code. Easily you can navigate all those. You will already have the option with you. So just if you go by description also, you can choose properly for HCPCS. So try to score 26 marks in the first section. At least you can score some 23 to 24 from the first section. And here if you consider 5 marks from each, okay, you will be getting 31 marks here. 23 plus 31, you got 54 marks. Okay, and then if you come to radiology, it is easy. Okay, consider you are getting again 5 marks, 5 to 4 average. Okay, so again you see how much marks you can score. 10, 15, 20, 25. Okay, so you had 54 marks and you had 25 marks. Okay, you got almost 75 here. Plus you from case study, average, if you score 6, okay, again you are getting more than 75. Okay, so this is the goal that you have to pass the examination. Okay, so if you aim to get at least 85 and above, you will somewhere end up getting at least 75 to 76 marks. Okay, but if you are aiming to get some 70 exactly, like skipping complete one portion and not studying it, assuming that I will score out of out from all other section, that will not work out. Mandatorily you should attend 100 questions, then the passing ability will be more. Okay, because somewhere you are making mistake also, the random question sometime it will be correct. Okay, so there you will get a add-on things. So attending 100 question is must and should. I most of the students will come and tell me I have left case studies, I did not get the time to attend that. Okay, so that is a very blunder mistake. You should not do that. Attend all 100 questions. So as I said, you have to flag the question. So if you save some 30 minutes, like you have attempt, like you have completed all 100 questions within 3 hours 30 minutes, remaining 30 minutes you can keep it for review whatever you have flagged. Okay, so there will be one option in the system itself. If you click on the flagged question, it will show like the dotted one will be there. It will show what are the flagged question. Like maybe in medical terminology you flagged the 3rd question, it will be visible. You have flagged this 3rd question. If you click on this dot, it will open. So then once again you verify, and whatever you feel it is relevant to the question, you can choose that answer and you can unflag that. Okay, unflagging is also important. And then throughout wherever you have flagged the question, just take some more time, review it and unflag the question. Okay, finally you will have the submit option. You can submit before 1 minute 2 minute is left, like you are already 3 hours 55 minutes, then you can just submit the exam. Okay, so this is how the exam format or the protocol should be. Okay, then while practicing how you have to practice, you have to take minimum 6 to 8 mock papers. Okay, if you have not taken any mock paper and you have followed any some important material, means it is not good. You have to take minimum 6 to 8 mock papers. So the mock paper from AAPC is designed to cover all the outpatient services. Okay, though you are preparing for 100 question, but practicing some 500 to 600 question will give you more knowledge on how to apply those in a real world scenarios. Okay, if you start working and if you get into urgent care projects, okay, maybe you are working with an ENM outpatient urgent care setting. In the outpatient setting, you will see a lot of procedure. Only ENM will not be there. Along with the ENM, provider will be performing laceration repair, incision and drainage, cerumen impaction. Okay, so there are so many minimal procedure you will get to see. So if you have already understood the coding guideline while preparing for certification, then you can prove yourself as a good coder, because you will come out of QC soon, and you will not be dependent on someone to like you should not keep asking same questions to the seniors. Okay, so easily while practicing for exam, you can cover all these things. And when you practice the mock, there will be rationals, right? If you read the rational, there will be pair specific guideline also. For example, Medicare. Okay, so if you take the ENM consultation for Medicare insurance, Medicare will not pay for consultation codes. Okay, so if you have practiced this while preparing for exam, it will become easy when you go and working as a medical coder. You already know the pair specific policies. Same way, Medicare has so many guidelines. Okay, we will have the G series codes for that. Now, there are so many instances we will not code regular CPT code. Instead, we will take the HCPCS codes. Okay, those are all pair policies. And then coming to here, compliance and regulatory, you should also have good idea on Medicare insurance, eligibility criteria for Medicare and Medicaid insurance, and what are the parts we have for Medicare. Okay, Part A covers what, Part B covers what. So Part A is for inpatient service, Medicare Part B is for outpatient, and Part C is an advantage plan. Part D is for prescription drug management. Okay, these are all the question. Okay, and then coming back to the mock. So while taking mocks, you have to keep a timer. So when you keep a timer, it will make you feel you are writing an exam. Okay, either you are practicing through print mocks, that is fine, but how much time you are taking to complete those 100 questions will really help you to understand like where in which section you are taking more time, or in which section you are losing marks. Okay, all those things you will be able to figure out only when you sit and work on mock papers. So the mock paper will help you to manage your time also. Okay, directly if you're going for some 100 to 200 questions, like you may pass the exam, but later in once you start the career, it will be really difficult to sustain. Okay, so that's why in this period you must figure out the mocks and how much time you're taking, whether you are taking 2.4 minutes for each question, or you are able to finish the question less than 2.4 minutes. Okay, that is also you will get to know. And also navigating the book. Okay, so you should know what is there in the book. Okay, like place of service is there in which page, or whether it is there in front pages or in the last pages. And same way, modifier, appendix A, appendix L, all those things you have to. ICD, you can just ICD is okay for exam perspective. If you are not able to handle the ICD book, it is okay, directly go to tabular list, check the option and figure out what is the correct answer through ICD. That will work. But when it comes to CPT, you should really have a good hands-on experience or hands-on practice through your book, CPT book. Okay, this is mandatory. And then if you come to the like all, as I said, 18 sections we have for CPC exam, and all sections you need to attend all 100 questions. And then come to like, as I think I have already explained everything here. And then lastly, coming to the documents. Okay, so once you book the exam or going to book for exam, the first thing, for membership, please give your first name and last name as per your Aadhaar card. Okay, as per your government ID proof. It should match. Whatever your first name and last name is there in the ID proof, same thing should be there on the membership. Sometime they'll give you first name, like like there will be kind of ignorance. People will not be aware, so they'll simply maybe they'll first select the last name into the first name. Okay, there will be mismatch. So if you do such mistakes and if you go to testing center, they will ask you, right? They will ask you to show your ID proof. When it is not matching, they will not listen to your explanation. Okay, they will just cancel your exam slot. I mean, your one attempt is it will go waste. Okay, so while booking, you have to or you have to just inform whoever booking the slot for you, or if you are booking by yourself, just pay some attention to the first name and second name, and also everything, whatever two ID proof, okay, one may be Aadhaar card and one is PAN, should be verified in the DigiLocker. It should be there in your phone. It should be there in the DigiLocker. When you go to testing center, they will ask you these three things. One is exam hall ticket, and then they'll ask you to show your digital, I mean through DigiLocker, they'll ask you to verify the ID proof. Okay, like they should match your hall ticket name, and your ID proof should match. And also you have to carry the original one also. Sometimes some proctors will question that also. So it is better to carry the original one, and as well with the DigiLocker. And so many testing center, the proctor who will sit there, they may not accept your childhood Aadhaar card photos. Okay, so few people who are good, like some people will be very kind, they'll not question on that. They will just see your name and they will allow you to write exam. But few will be like kind of people, they are simply check, when they check the photo and the photo is from childhood, they'll simply say your photo is not matching your current thing, so we cannot allow. So that should not happen. So better update your Aadhaar card photo also for the recent one, not the childhood photo. Okay, and then coming to what else? Yeah, so after that, mainly go to the testing center at least some 30 to 40 minutes early. Okay, if you just go in a rush, like 5 minutes left or 10 minutes left, you may feel more panic. Okay, that's why go early, go at least 30 minutes before to your exam slot, sit and see how the testing center is. Just familiarize with the testing center. And when you sit some time in the testing center, eventually you will get to a calm face. Okay, so that is one important thing. And most of the testing center, they will not even allow water bottle also. They'll not even allow watch, and no metal on your like if you are wearing some jewelry, they'll ask you to remove those jewelries also. Water outside, they'll keep water. So every 1 hour you can take one break for water or restroom. You can take that break, and you can go to washroom. Also, if you want to drink water, you can take that. Okay, so likewise here in Indian testing centers work. So then what else? I think, yeah, so revision. Mainly start with the, firstly, CPT is important, since you already know 67 marks you are getting from CPT section itself. So all surgery chapter, okay, start practicing chapter wise. For example, if you are starting integumentary chapter today, you must complete the chapter wise questions, and you need to correct yourself if you are making mistake in any concepts. Okay, and then you can move to musculoskeletal. Likewise, firstly, you need to complete all chapter wise practice, all chapter wise question paper you need to solve. Then only you need to shift your focus to ICD. Under ICD, as we all know, coding guidelines, 3 marks coding guideline, 3 to 5 marks. Okay, 5 marks you can take for ICD coding guideline. 5 marks coding guideline questions will be there. Okay, so from endocrine system, okay, regarding maybe insulin pump malfunction, overdose, underdose, Okay, and if type of diabetes is not specified, what type is default. And same way, coming to hemiplegia, when the dominance is not specified, what is the default coding guidelines we will take. And then coming to the chapter 5, okay, there we will be having same substance where the provider has documented use, abuse, and dependence. Okay, we need to take dependence. And also we will have coding guidelines for chapter 19, okay, related to poison and injury. So in if you just check once, if you have a glance on all chapter specific coding guidelines, it will become easy to score that 5 marks also. Okay, so mainly from ICD you will get 5 marks coding guideline, and remaining 3 to 4 marks direct questions. Okay, so the question also I think I have uploaded in YouTube. You can just check that regarding respiratory, okay, dyspnea and viral pneumonia, and so many ICD question. And also diabetes mellitus with maybe macular edema, something like I've posted already. Once you can just check that. So from ICD also you can score at least 6 to 7 marks easily. So only thing is you need to understand the exam structure well, and before attempting the direct exam or before going and sitting on for the exam, you have to take your some time, dedicated time, at least 20 days or 1 month, like focused completely on exam. Like whether you are practicing chapter wise and then you're going for mock papers, take mock papers, at least 6 to 7 mock papers. And if you are not getting above 70, then there is a problem. Okay, so again you have to do the revision for those mock papers, so you can just revise where you are making mistakes and what are those concepts or what are those section you are not able to score marks. Okay, all those things you have to figure out by yourself, and then you have to go and write the exam. Okay, so if you have already taken a course, that means you have already committed for the field. Okay, medical coding field, that means you know that you are going to like start your career in medical coding. So for medical coding you need to have a good subject knowledge, then only you can sustain in the field. Okay, if you are making continuously errors and if you are not able to figure out what it is, like the basic is not strong, means definitely you will feel like that. Nobody will come and help you. Like no, in once you start the career, nobody will sit and next to you and they'll say, hey, you don't know this ICD guideline, while assigning this code you should once refer that guideline. No, why did you make this mistake? So it's a blender. There are protocols to do some codes in such way, but you are not referring, or if you don't remember, or if you have never learned that, then it's kind of blender. Okay, you cannot really give the good accuracy. When accuracy is not there, you cannot expect the growth in the field. Okay, so that's why subject matter, or how you will learn the concept in the learning phase is very important. Okay, so that's why please do proper mock preparation and then only book your exam slots, and then you can go for exam and write the exam. And after exam also there will be so many protocols will be there, how to maintain your certification, what are the annual charges, okay, what is CU, all those. So everything I have already posted on my YouTube channel. And then sometime if I take any live session on the CU related, or if I have any chapter, like if I am going to be a speaker for any other CU session, I will just post in this group also. Like since already group is created, so you can check that. Okay, later after getting certification, there will be so many other things to look after, so we'll guide that in any other session. Okay, so far if you have any particular doubt on the exam related stuff, you can ask. Okay, if you have not have any doubts, then anyone have any doubts?
Ma'am, how many days before we need to book for exam?
See, if you go for individual booking, okay, individual booking is something, I have an individual membership. Okay, if I want to book my exam within 1 or 2 days, I can book my exam. Okay, that is what individual membership refers to. If you want, like individual membership will not have any discount and all. And currently, if it is from India or from UAE, if it is costing 79,000 to 80,000, that will remain same for individual membership. So for individual membership, what will happen? Every email come to your mail. Okay, you will have the transparency, how much they are charging for membership, how much they are charging for 2 attempt exam, and you will have that kind of individuality to connect with the APC also if any problems. Okay, that is individual membership. So
Okay.
other memberships are there, student membership is there, and corporate membership is there. So many institute, what they will do, they will be a corporate vendor. So within their corporate membership, they will insert their students. Okay, so they will get a discount. So when you get discount, I mean, that time you cannot expect within 2 days your exam going to be scheduled. Okay,
Okay.
so
Okay.
it will take a lot of time, maybe 1 month, and maybe 15 to 1 month is like 15 to 1 month will be there, because they'll do bulk booking. So they need
Okay.
to sit and do all the stuff. So it will take more than 1 month to get you a proper date. If you go by individual, today if you pay or if you purchase the voucher, tomorrow itself you will get an email to schedule your exam. And then if you check the dates, slot availability, if a particular slot is available according to your convenience, you can book it.
Okay, ma'am. Thank you.
Yeah.
Which is the best way, ma'am? Whether booking individual is better or group is better, ma'am?
Like it depends on the person. Okay, like if person want, like few people will be like prefer to be on their own, like they'll be purchasing through credit card and all. Both are, like, you cannot say corporate is bad or individual is good. They will have